Hello everyone, today I'm going to show you differentiation of syndromes of脏腑visceral. We learned the differentiation of syndromes last time. In this section, I will introduce another method of differentiation of脏腑visceral syndromes. As we know, TCM is not founded on precise anatomy. Internal organs, more actually called脏腑visceral, actually refer to the major functional systems of the human body. Therefore, the pathological changes of internal organs should not be misunderstood as the patho-anatomical changes of organs and tissue on which Western diagnosis of diseases is based. We have learned the 5 zang and 6 fu before, and their corresponding relationship are as follows. I will introduce to you the differentiation of脏腑visceral syndromes. Let's look at the first one, the lung and large intestine syndrome differentiation. The causes of lung and large intestine disorders can be classified into 2 patterns: excess factors like wind, cold, heat, and dryness, and deficiency factors like qi deficiency, yin deficiency, etc. Our lungs are like the umbrella covering all other organs and preventing them from the invasion by 6 excesses. Wind, cold, heat, and dryness are most likely to invade the lung first when they get into the body. Lung diseases may have the following manifestations: cough, asthma, shortness of breath, fever, sore throat, stuffy and runny nose, etc. For example, the baby with fever, chills, stiffness, headache, thin white tongue coating, and floating pulse, his syndrome pattern is one cold invading lung. And the other patient with cough, fatigue, spontaneous sweating, inclination to catch common cold, thin white tongue coating, and feeble pulse, his syndrome pattern is lung qi deficiency. Next, let's learn the heart and small intestine syndrome differentiation. The causes of heart and small intestine disorders can be classified into 2 patterns: excess factors like static blood, qi stagnation and film, and deficiency factors like qi, blood, yin or yang deficiency, etc. Heart diseases may have the following manifestations: chest pain, chest tightness, cardiopulmonous, different kinds of mental changes, insomnia, etc. For example, the old man with severe chest pain, radioactivity like needle stabbing, slight chest tightness, light right tongue with purplish dots, and knotted pulse. His syndrome pattern is heart blood stasis. If the chest pain is not that severe but more tight, the left right tongue is with thin white coating, and the pulse is hesitant, his syndrome pattern is heart qi stagnation. If the patient manifests different kinds of mental changes, they may suffer from film covering the heart. Okay, let's move on. The spleen and stomach syndrome differentiation. The causes of spleen and stomach disorders can be qi deficiency, yang deficiency, excess factors like film and improper diet, excess heat or cold in the stomach, etc. Spleen and stomach diseases may have the following manifestations: nausea, vomiting, stomachache, abdominal pain, abdominal distension, indigestion, diarrhea, etc. The first lady with severe abdominal pain prefers something hot or warm to something cold and cool, and prefers to be touched, and she is with light taste and no thirst, with thin white tongue coating but thready and tight pulse. Her syndrome pattern is cold invading the stomach. If the patient feels nausea, vomiting, abdominal distension, and indigestion with curd-like or slippery tongue coating and slippery pulse, he may suffer from the improper diet of the syndrome of damp heat invading stomach. If the baby suffered from abdominal pain, abdominal distension, indigestion, and diarrhea with thin white tongue coating and feeble pulse, his syndrome pattern may be spleen qi deficiency. Next one, the liver and gallbladder syndrome differentiation. The causes of liver and gallbladder disorders can be yin deficiency, blood deficiency, and excess factors like excess or damp heat and qi stagnation. Liver and gallbladder diseases may have those following manifestations: hypochondrium, distension or pain, dizziness, headache, tinnitus, impatience and irritability, sigh, apoplexy, insomnia, jaundice, etc. If the patient is depressed with small sights, anorexia, and hypochondrium distension, and he is with thin white tongue coating and stringy pulse, his syndrome pattern is liver qi stagnation. If the patient suffered from headache, tinnitus, dizziness, impatience, or irritability, as well as insomnia, and he is with yellow thick tongue coating covering a right tongue and thready or slippery pulse, his pattern may be the liver fire ascending syndrome or hyperactivity or liver yang syndrome. If the patient has yellow eyes, yellow complexion like an orange, chin like urine, abdominal distension, abdominal tightness, nausea and vomiting, and he is with yellow thick tongue coating covering a right tongue and slippery pulse, his pattern is the liver gallbladder damp heat syndrome. The last one, the kidney and bladder syndrome differentiation. The causes of kidney and bladder disorders can be some deficiency factors like qi deficiency, yin deficiency, yang deficiency, and vital essence deficiency. Kidney and bladder disease may have the following manifestations: lower back pain, fatigue, developmental delay, impotence, prospermia, spermaturia, erysis, irregular menstruation, infertility, etc. If the patient is with fatigue, lower back pain, hotness in palm and foot, irritability, prospermia, right tongue with thin white tongue coating, and a thready pulse, he may suffer from the kidney yin deficiency syndrome. If the patient suffers from lower back pain, prefers something warm to something cold, and is with impotence, nocturnal polyuria, infertility, light right tongue with thin white tongue coating, and weak pulse, his pattern is the kidney yang deficiency syndrome. Okay, here comes the end of this class. What I've shown you is complex and difficult, but when you grasp the principle of differentiation, it might be easy.